Okay, hello and welcome everyone. Dr. Rich Castellano here, double board certified facial plastic and reconstructive surgeon. We're here today with Carol. Carol, how are you doing, dear?
Wonderful.
So Carol has had some of the relaxing medicine, and we're going to be doing a laser image lift for the neck and jawline for her. She looks wonderful, and she just wants to do a little tightening, okay, and improve her appearance. There's Nina, so wave hi. There's Nina, and hello, Dr. Rich Castellano here. So we're going to zoom in so we can take great care. You can see a better angle for Carol. This is under local anesthesia, like at the dentist's office, and we give a little bit of relaxing medicine, the Valium, and that way Carol is comfortable. Hello, and it is Eclipse Day today, so but what a great day to do a lifting procedure. So we are in Tampa, Florida, and in the Villages, Florida. And when we do these types of procedures, this is not skin only. People talk about, can you connect this so that way that goes on here? Okay, so you just need to, yep, we're getting everything. And thank you, Charlene, for setting everything up for us. Excuse me. Push it all the way in. Okay, so check us out at ImageLift.com. We're doing a face-lifting procedure under local anesthesia where we lift the skin, tighten the muscle layer. That's called a SMAS tightening or SMAS imbrication, where we lift the SMAS and layer it on top of itself like shingles on a roof. And we'll also be doing some laser treatment for the skin. We lose the elasticity. Can you read those out, please?
Watching the solar eclipse today?
Well, yeah, if we're done in time, we will. But it looks like you can watch it on Periscope so that you don't have to look into the sun.
If I invite followers, can I get free Botox?
If you invite followers, can you get free Botox? Well, technically, I'm not supposed to offer discounts for patients for referrals. That's just the way the law works. Now, we get a lot of referrals, and we always love to take care of our patients. The bottom line is, come in, you'll love our services, but I'm not technically allowed to have a program that says, hey, if you give me this, I'll give you that. But we definitely take great care of our patients, so thank you for asking. And we get a lot of referrals almost every day. Patients and family and doctors and friends send patients over. But I have found out that you should never tell your family or friends that they need to see a facial plastic surgeon. It just doesn't go over well. So what we do is we just offer people if you call to our office, you can have a free consultation, a free facial mask treatment with our esthetician. Okay? And marker. So that's the best way to send referrals in. And email me your pictures if you have questions, consultation questions. Email me at rcastellano@imagelift.com. Can you hit the button, please? Mm-hmm. And then this is the little marker pen. I'm going to turn your chin all the way up. Is that okay for you like that? Very good. So Carol's had some of the relaxing medicine, and if she wants a little bit more, we can give her more if she feels comfortable. We just wanted to zoom in a little bit on the bottom one there for me, please. On the bottom, if you could zoom a bit. Please follow us on YouTube, youtube.com/ImageLift, Facebook. This is 1% lidocaine with 1 to 100,000 epinephrine. That's a 30 gauge. Pinch on 3, 1, 2, 3, pinch. YouTube and on Facebook and on Periscope. A little pinching there, and I'm not in a hurry. If you need a break, Carol, everything's looking good. A little pinching through here. So once I numb, afterwards she can't feel anything, but she will feel some pinches. Now, this is where I use what's called a tumescent solution. So this is a tumescent solution. Oh, thank you very much. Yes, we do our best to make sure people feel comfortable. Please do invite your followers. Swipe left or right on iPhone. Do you feel a little bit of a pinch there, Carol? Mm-hmm. Big pinch, little pinch, medium pinch? Very good. So, and if you're on Android, you swipe up or down to invite your followers. They're going to get upset if you tell them you're watching live surgery and you did not invite them. And right now, the eclipse probably is not where you are yet. I think on the East Coast, they're getting a little, or the West Coast rather, they're getting a little bit of the eclipse. So this is the best thing to watch on Periscope. Once the eclipse comes, then this will be not as interesting as the amazing eclipse. But of course, we think that Carol's pretty amazing, so everything's looking good. So Carol, can you tell us what was it that made you decide you wanted to do a tightening procedure for your neck and jawline?
I had had a complete facelift 11 years ago, and one of the muscles in the neck dropped.
Uh-huh.
And it was noticeable, and a friend mentioned it.
Uh-huh. So that was the decision maker that said, hey, you wanted to do something about it.
Mm-hmm.
Okay. Well, we're glad that you're here. You've come to the right place. We will take great care of you. And patients come to us because they don't want general anesthesia.
Mm-hmm. Why should we?
Yes, so it's safer this way, less risk, less expense. Patients don't want to be put out, and the results are amazing with the ImageLift procedure. We love to add the laser to it. So you don't want to have a traditional old-fashioned facelift. Patients don't want extreme. They don't want overdone. That's why we're doing what we do today. Thank you for tuning in. Make sure you're following us on social media, Periscope, Facebook, YouTube. A little pressure, a little pinch. For those of you just joining, let us know where are you tuning in from and what is your background. Are you medical, non-medical? Are you in the United States or international? I see there is some foreign language there. If you don't speak English, you won't understand that question. Everything's looking good, but we have people from all around the world. Privyet if you're in Russia, salam alaikum if you're in Middle East. B. Gates for our German friends, bonjour.
Tampa.
Hello and welcome.
Counselor.
Hello, Tampa, mental health. We do a lot of mental health counseling in our practice.
Germany.
B. Gates from Germany.
Ohio. Wish I was a doctor.
Ohio, well, it's never too late to become a doctor. You can go to medical school on YouTube,
Hello
actually.
from Brazil and Russia.
Hello, Brazil. Privyet from Russia. Welcome. I've never met a doctor that has not learned something on YouTube.
Most don't connect self-image and mental health.
Yes, it's so important. Hello from Finland. Yes, the mental health is more important. It's all about self-image. And that's what I love about what we do.
Worked in a nursing home.
Okay, wonderful. And it's amazing how when you change the appearance, you do change the self-image. Very good. Forensic pathology. Hello, Yale, Harvard. Carol, how are you feeling, dear?
Fine.
Carol is doing very well. Some people say, is this real? It does not get more real than Carol.
What's all the puffy stuff?
So we're numbing medicine. It's called a tumescent solution. So that way she doesn't feel what we're doing. Thank you for the question. Everything's looking good. Thank you for keeping your comments nice and supportive. Are you feeling any pain there, Carol?
No.
I'm going to turn your head to the side. She says no. I believe her. I always ask patients, do you feel uncomfortable? You tell me. And thank you for the super hearts. So it's puffy. Thank you very much for keeping your comments nice. No, it's puffy because of the swelling and the numbing medicine, but that goes away.
I'll tell you when they come in.
Some people say, well, why don't we just grow old gracefully? And so usually the younger you are, the less you may understand how changes to the face affect our appearance. As we get older, people treat us differently based on how young or how old they think we are. In the workplace and in the relationship, the most important person that treats us differently is ourselves. And so this is certainly not for everyone. There are some people that watch this and say, well, I would never do that. Well, that's great. But there are many people that want to, this is like getting your teeth cleaned, or it's about, it's our way of fighting ageism, but really it's just about self-maintenance. People are living longer,
Yes.
They're living more active lives. Thank you for your comments. Thank you for your questions. And so a lot of our patients say, they're not ready to throw in the towel. They have many active years ahead of them. These are some of the best years of their lives. So that's why it's such an honor, thank you, Charlene,
You're welcome.
to be here to help Carol on her journey, and what a wonderful person she is. She certainly has a high smile score. She knows the power of smile. And when you have patients like this, it makes your work fun. I tell people I'm retired. I just get to go hang out with people that I like. That's correct. Yeah, you have an internal feeling of how you are, and cosmetic procedures help you to match that. So I tell people I'm already retired. I love my team. I'm so proud of our team, and thank you to Nina and Charlene and Elise is out today. Thank you to all of our team, Mindy, Violet, Stephanie, Euphemia, Ginger, Jennifer, Thomas, and Ginger. And we've got an awesome team, and we have awesome patients, so I consider myself retired. Right now, I am working so hard. You know, this is hard work, but it's not hard work because I'm enjoying it, and this is what I've done thousands and thousands of times, and it is a privilege.
Office?
We do an office-based procedure. We have a surgical suite here that we have an outside consulting firm that monitors our practices to make sure we're always improving our standards, and that's the way that it should be.
What made you want to do this kind of work?
I enjoy the artistry of it. I enjoy how you really can make a difference in someone's life by helping them create an appearance that is more congruent with who they feel they are on the inside. Oh, that's wonderful. Yeah, I've helped with cleft lip and palate before. I don't do that currently in my practice. It's very specialized. But that is certainly a very amazing treatment when a child has a cleft lip or palate and you can treat that. But believe it or not, there's a lot of people who are very normal in their appearance, but they have a social or psychological stigma.
Someone said they had a cleft palate repair?
Yeah, absolutely. It's life-changing. And they walk around and their confidence can be low just because they don't believe how amazing they are. So whether a cosmetic surgery helps them, oh yeah, wow. Yeah, pretty amazing. It's amazing what plastic surgery can do. So please do share with your followers. Let them know this is the future
Do you
of
remember your
plastic
first
surgery.
operation?
I remember the first time I stitched up a patient. I was in the ER and middle of the night, and someone was drunk and fell off a curb and was all. Feel a little pinching there?
Mm-hmm.
If you need a break, you let me know.
Okay.
And that's what happens. You start stitching up some people, and then you get better and better. Very good. Medical school in Charleston. Very good. And so the more you do, the better you get, and then you start doing procedures, and before you know it, you're doing the whole procedure. Very good. Yes, you got solar glasses. You don't need the solar glasses to watch this, though. You can look directly at the camera for this, but just not at the Eclipse. Thank you for joining in. For those of you just joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We are here today doing an ImageLift laser lifting procedure. Yeah, stitches. That's a popular surgery song. Mendez. Thank you for tuning in. Thank you for sharing. Everything's looking good. We have 4 principles when we help people look younger. If we sag, then we tighten. If we lose volume, we fill. If we get sun damage, wrinkles, and sunspots to the skin, we polish and repair the skin. And then the 4th category outshines everything else, and that's our behavior. Yes, I believe it's better than the behavior. This is preliminary because we're going to start the procedure here in just a moment, but I like to make sure that Carol is nice and numb. Let me turn your head all the way to the middle, and then I'm going to turn your chin up a little bit. Is that okay for you like that?
Yes.
You feel a little pressure, a little pinching here.
Is she asleep?
She's awake. How are you feeling, Carol?
Not asleep.
She's not asleep. She's the real deal. Some people will ask you, say, is this real? It does not get any more real than Carol. She is the real deal. So Carol will feel pressure. She'll know that I'm there, but she can't really tell what I'm doing. 27, please.
Mm-hmm.
Someone said, what's the most difficult procedure? It is a procedure that you don't do that often. So that's why you want to make sure you have the right specialist. You know, a lot of doctors know how to do fillers, they know how to do facelifts, but that doesn't mean that they're an expert in doing it. So you want to go to someone who does a lot of them and focus on that. People ask me, do I do tummy tucks or breast procedures? Now, when I do the lift, if I pull really, really tight, sometimes you get a little tightening in the tummy. I'm just kidding. And so we only focus on the face and neck. Someone says, isn't it safer to put patients to sleep? I'm going to turn your head to the side. And actually, it is not safer. It is safer to do things under local anesthesia. That is recognized as true for all of the regulatory agencies, and it's just common sense. People come to me, they say, well, you don't want to put the anesthetic in their system. They don't want that additional recovery. And after we're done, we walk patients to their car. So as long as patients know what their options are, they can choose what's right for them, but this is clearly less risk and less expense than general anesthetic. So that's why patients do this. Pinch here. You feel a little pinch there, Carol?
No.
A little bit of numbing. You might feel a little pinch here. Everything's looking good. Thank you for tuning in. Please do share. We will be rebroadcasting in a little bit. Make sure you're following us. ImageLift on Periscope, Twitter, Facebook, and YouTube. Very good. Well, yes, they're life-threatening, anesthesia risks. You're minimizing that with local anesthesia. I mean, this is like at the dentist's office. You feel a little pinching there?
Not a little bit.
And we don't, you don't require an IV for something like this. And
Does it depend on their overall health?
the health does help, but age, interestingly, does not matter as much as their health status. So older patients are doing fine with cosmetic procedures. Let me turn your head this way. It really just depends on their health history. Marker. So now I'm using my marker to mark on the other side. That's a surgical marker. Yes, those things can happen. However, you want to screen your patients carefully. And so, I mean, people walking in the airport, goodness forbid, they can have, a heart event or something like that, but we have all the emergency equipment, but we've done the screening. Carol's very healthy. We're in communication with primary doctor. And so if patients can tolerate going up a couple flights of stairs or tolerate 20, 30 minutes of exercise, they're not going to have any trouble tolerating what we do here. Very good. Thank you for your comments. Now I'm doing 1% lidocaine with 1 to 100,000 epinephrine. That's a 27 gauge needle, 1.5 inch for the medical students and physicians that are
Really
watching.
great at CPR.
Very good. That's always good to know. Everybody should know that. Now, as far as the local anesthesia, it usually lasts about an hour, a little pinching there after we're done. So she feels a pinch there. Thank you for your comments and thank you for your shares. And we keep all the equipment here as needed. But as far as, it's interesting because I had a patient who was actually another doctor. And we were finishing the procedure and they were groggy and it didn't make sense to me. They just took too long to wake up. I said, did you take any other medicine than what I gave you? They said, no. I said, it doesn't make sense. I'm going to send you for observation. If I need to send someone for observation or send them to the hospital, I do. This was one of the rare times that I did. And they did a drug screen and they took the medicine and didn't tell me. They took some additional pain pills plus the Valium. So let me turn your head all the way to the middle. Chin all the way up for me, please. 15 and fine teeth. Thank you for your comments. Thank you for your shares. So I highly recommend that you tell your doctor all the medicines you take. Now you'll feel a little pressure here. Do you feel any pinching there at all?
No.
Sure, I've had dreams about doing surgery. I mean, I do a lot of surgery. And most doctors retire after doing 500 or 1,000 facelifts. I've done 3,500. And we're very proud to be the #1 Bellafill injector in the United States. So certainly I've had dreams about doing surgery. We will be rebroadcasting in a little bit, so make sure you are watching, you are following, and share. So a little bit of cautery just to seal the blood vessels. This is the bipolar. Right, some people call it like a C-section where you feel pressure but you don't feel any pain. Everything's looking good. Now I'm just going to do a little bit of the liposuction. Can you turn that on for me, please? So this is our cannula. Sure, you could have that. Can I stand over here, please? Everything's looking good. Thank you for tuning in. We broadcast your comments. We have a little jumbotron here that broadcasts them on the wall, and so it's easy to see your comments. And as you can see, this is not any type of emergency procedure. I can just pause at any time. And we take it at a casual pace here, always fast, but never hurry. And that's the nature of what we do. A lot of patients will watch our videos and say, well, I saw how comfortable your patient was. That's why I feel confidence in what you're doing. And there's no filters here. There's no editing. Obviously, we feel very confident about what we're doing to share live so that you can ask questions. This is how teaching is done in teaching institutions. Carol, how are you doing, dear?
Good.
Everything's looking good. Where the attending is performing the procedure and the students and residents are watching over their shoulder, and now you can watch over our shoulder with your AT&T or Verizon plan. Yes, they do look different after they heal completely. They look natural. Most patients, we tell them that they'll pass the grocery store test within 7 to 10 days afterwards.
Every so often how she's feeling.
Yeah, I like to ask. I can tell usually if a patient flinches or has a wince. I know that they may feel a little pinch or something, but I like to ask. That's right. Everything's looking good. Yeah, immediately afterwards there is going to be some swelling. Now we are going to rebroadcast here in just a little bit. We're going to start with the laser. And when I do the laser precautions are... Can you hit the button for me and turn that off, please? We use an eye shield over top. The best protection for your eyes is to keep your eyes closed. And then the third protection is that we only engage the laser when it's in a safe place underneath the skin. So we will be rebroadcasting. Thank you all for tuning in, and we'll be right back. Yes, we absolutely will. Can you finish all of them? Yeah. You can leave that one running. And then bring that one down. Thank you. And that one. Not from the super top, yeah. Just to finish top here on the bottom. It's in the lower right-hand corner. Perfect. Yeah. Oh. Thank you. And then X, and we just want to restart those up. Perfect. Here's the little eye shield. And can you turn that on for me? Do you have your goggles? Charlotte, you have yours? Thanks. Very good. Carol, how are you feeling, dear?
Relaxed.
Everything's looking good. Pull out some extra gloves for me, please.
They're right there, showing you that
Perfect.
tissue.
Do we have more gloves?
Yeah, I'll be right back.
Okay, thanks. Very good. Everything's looking good. Can you... Oh, she's getting the goggles? Okay, good. Perfect. Yep, can you zoom in on this for me, please?
I'm right behind you.
Hold on. Zoom in on the top one there. Zoom in there. Perfect. All right, hello and welcome back. Dr. Rich Castellano here, double board certified facial plastic and reconstructive surgeon. We are here today with Carol. We did a little bit of the tumescent solution and the liposuction, and now we're going to be doing laser lipolysis. Now the laser tightens the skin. It creates a thermal injury under the skin. And that creates some tightening with the myofibroblasts. And can you zoom out a little bit on that top because we might get a little bit more focus. Thank you. Very good. We are in Tampa, Florida, and in the Villages, Florida. Thank you. Now this is the, oh, Charlene, we need to get that, is the, it's still on the middle one. We want to make sure that it's center the top of her face. And you're bumping into the cord, so you'll need to not, you're bumping into the cord. That's perfect. So you need to notice how that middle one, how her, is kind of, it's on Periscope. There we go. So, yeah, that's fine, just like that. That's perfect.
Okay.
So this is the, okay, perfect. That's the helium neon beam right there. That's a guidance beam where we deliver the laser energy. And then What was the number on the laser?
114, 121.
Perfect. And you hear little popping noises, which is the photoacoustic effect. It turns light into sound energy. Very good. Carol, how are you feeling, dear?
Good.
Perfect. So always fast, but never hurry. Laser tightening, it basically dissolves and removes some of the fat and causes a heat injury under the skin to get some contracture of the skin. The myofibroblast scars will contract. Very good. Everything's looking good. We are in Tampa, Florida, and in the Villages, Florida. You can look us up on Amazon.com as well. Both of our books are there. And we're also on Audible, so you can learn more about what we do from the privacy of your home. And definitely visit our website, ImageLift.com, for more questions. We thank you for your questions, and thank you for your shares. It's a great day to watch the eclipse, but we certainly feel this is the most interesting thing happening on Periscope today while the eclipse is warming up. Thank you for joining in, and thank you for sharing. I am Dr. Rich Castellano here. So facelift under local anesthesia for the medical students and physicians that are watching. Thank you very much. Yes, the Hippocratic Oath, first do no harm. So this is teaching and education. A lot of patients enjoy being a part of the video because they learn themselves. They say, well, I may not have thought to ask that question. We only do it with patients' permission. And so thank you very much. Lots of hearts and shares for Carol for allowing us to do this. It is certainly very ethical and legal to do these types of things because it's all about teaching. The root word of doctor, docere, is to teach. What was that question, Nina?
What's the procedure today?
We're doing a facelift under local anesthesia. Thank you for tuning in. Thank you for the hearts, and thank you for the shares. Everything's looking good.
Is she awake?
It does not get more real than Carol. Carol, are you feeling any discomfort at all, dear?
No.
Everything's looking good. So she'll feel comfortable throughout the procedure. If she feels a pinch, I'll give her a little bit more numbing medicine to make sure she's comfortable. Most patients say we're easier than the dentist's office. Thank you for the hearts, and thank you for the shares. So this is laser lipolysis. This is the Cynosure triplex. Thank you for tuning in. Thank you. Please do share and let others know you're watching live surgery. Because the eclipse is happening in some places, but not happening here yet. Not till 2 o'clock or so. Very good. We are in Tampa, Florida, and in the Villages, Florida. So I just very gently can put the guide, the probe here that carries the fiber optic under the skin, and I thread it subcutaneously, and it heats up the fat cells and destroys them, and then that gets absorbed. And it also creates a thermal injury where the skin creates a contracture to tighten up. So we're on Facebook, we're on YouTube, and we're on Periscope, so make sure you follow us. We usually get anywhere from 2,000 to 10,000 viewers every time we do a broadcast, and we're very proud to share what we do. We have students who come through all the time, so whether they're students in person, we help with the Brain Expansions program called BEST, Brain Expansion Student Training. It's scholastic training, and so they're at-risk students that are wanting to be in healthcare positions, and so we mentor and shadow them, and they come through the office. We've had medical students from USF come through, and we've also had students from all walks of life come into our office. And there was a time when I was a student and other doctors let me come through. Everything's looking good. How are you feeling, Carol? Good. Perfect. Thank you for joining in. I measure how much laser energy I deliver by the number on the machine. It tells us the joules that we deliver. I measure the temperature with my fingers. I can feel the warmth. And then we have an external temperature monitor. Hello, thank you for tuning in. Bonjour. Welcome. So all of those parameters allow us to make sure we have a safe experience with the laser tightening. Thank you for inviting. Appreciate that. Your friends are going to love you for sharing live surgery. If you're just joining in, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're here in Tampa, Florida, and in the Villages, Florida. If you're just now joining in, let us know, where are you coming from? Are you in the United States or international? And what's your background? Are you medical or non-medical? Yes, Carol is very much alive and real. It does not get more real than Carol. So thank you for tuning in. Just let us know, where are you tuning in from? Are you in the US or international? And what's your background? Are you medical, non-medical, engineering, attorney? If you don't speak English, you won't understand that question. Bonjour, welcome. Thank you for tuning in. Please do share. We are in Tampa, Florida, and check us out at ImageLift.com. Yes, this is a surgical procedure, so it's not for everyone to watch, but there are a lot of people that want to learn. Thank you. Hello from Oklahoma. Yes, it is. I think it's pretty fascinating to watch. It is interesting what people do. Thank goodness we live in a free country and that we have these choices. Usually takes me a couple of hours to do the procedure, maybe an additional 30 minutes to do the laser lipolysis. Traditional facelifts can take 2 to 4 hours to do. Some people talk about being under anesthesia for 6 or 8 hours. So we're basically tightening the neck and the jawline to improve the neck and the jaw area. And we will be showing some of Carol's pictures again. We showed them in the last broadcast. Very good. We want to tighten the neck and the jawline. Thank you for tuning in. Thank you for the hearts, and thank you for the shares. We are in Tampa, Florida, and in the Villages, Florida, so make sure that you are following us. Carol, how are you feeling, dear?
Sleepy.
Very good. Patients tell us they feel very relaxed. I feel pretty relaxed too. Yes, we do numbing medicine, and then we do the relaxing medicine like at the dentist. Patients don't want general anesthetic. They don't want to be put out. There's risks with that and expense. Thank you for your comments. Thank you for your shares. Everything's looking good. We're doing a facelift under local anesthesia, and this is the laser lipolysis. The laser removes some of the fatty tissue, and it tightens the neck skin.
Are you going to watch the Eclipse?
Well, right now, the jawline is being eclipsed by the extra skin and tissue, so we're removing that eclipse here, so you can see her true jawline. Thank you for tuning in. Thank you for the hearts, and thank you for the shares. Right in through here, please. Yeah, the incision line is very difficult to see, the highest 1 inch. So it hides and heals very nicely. Anytime you make an incision, it does leave a scar, but you really can't see it, and it's very rare that I have to do a scar revision. Thank you for joining in. Welcome for your first day on Periscope. If you're just now joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We need our French translator here. There's some French comments going on. Very good. Everything's looking good. Perfect. Yeah, there's really no bleeding at this point when you're in the right plane, and we use lidocaine with epinephrine. And patients don't want to be put completely out because it's riskier that way. So please do follow us on Facebook so you can learn more there. Temperature right here for me, please. Very good. Thank you for following. Thank you for the shares. Definitely let your friends know you're watching live surgery because they're going to want to know. It is pretty amazing what modern technology can do. Very good. And that we can have a global audience just from our AT&T and Verizon plan. But this is really the best way to do teaching.
Did she feel anything?
No.
She says no. Usually Carol, she'll feel some pressure. If she feels a pinch, I'll treat it and give her a little more numbing medicine, but most patients don't feel. Thank you so much for joining. Thank you for inviting your followers. Right here, temperature. Very good. The highest that you get. Perfect.
Right here.
Uh-huh. Thank you. Thank you for joining. Thank you for the hearts, and thank you for the super hearts. We've been getting a lot of the super hearts. We're proud to be bronze status for the Periscope. We do a lot of videos. We do a lot of teaching. Thank you. And we'll be in Chicago in September to do some teaching and training. We're going to be in October. We're going to be in Phoenix. In November
What's the
is
downtime?
Miami. There's physical versus social downtime. Physically, we get back into our routines, errands, shopping, things around the house right here. Within a day or two, socially, we pass the grocery store test. 7 to 10 days, you walk into the grocery, nobody really does a double take. Thank you very much for your comments and your support, and thank you for sharing. It's not for everyone, but at least people have an awareness of what is possible. Because some people are unaware. They think they need general anesthesia to do a lift like this, and you absolutely do not. Very good. Thank you for tuning in. Thank you for the hearts, and thank you for the shares. So we're almost done with the laser lipolysis here.
What's the cost?
People ask about pricing for these things. I think it can be misleading to just give a price if you don't have a consultation. Because you can pay anything you want for plastic surgery. You can get it for free. You'll get what you pay for. You're going to find some people that want to practice. Generally, the more experience a doctor has, the higher their prices are. And so you need a consult first, because that way it puts it into perspective. You may need more or less than what Carol's doing. You may want more or less. And there's so many different factors. You got to make sure expectations are in line. So you can email me photos, and I'm happy to do virtual consultation with your pictures. rcastellano@imagelift.com is my email. rcastellano@imagelift.com. Perfect. And so some people, they just ask me for referrals. They say, well, I was interested in a breast or something procedure, and depending on where you live, I will refer you. Thank you very much. Thank you for your comments. Appreciate that. My pleasure. Thank you for sharing. We'll share if you share. So the more you share, the more we can share. And we've been asked to speak at national meetings on how are we reaching people all across the world. And this is the future of teaching. Absolutely, there's no doubt about it. Live video streaming is the future. It's easy to do. It's effective. Temperature. Yeah, if you want a breast procedure done, you want to go to a breast specialist, someone that focuses only on the breast. So thank you for the hearts, and thank you for the shares, and thank you for the super hearts. We've been getting a lot of super hearts. This is pretty amazing, and I've been doing my education since, well, I started college in 90. So, and I finished my training in 2005, so I was 15 years. I've been practicing for about 13 years, 12 years. 13 years next year. So I still haven't been practicing as long as I've been studying, but you're always a student, you're always learning. And I'm honored to have done 3,500 facelifts. Look us up on Amazon. We have 2 Wall Street Journal best-selling books. Perfect. Temperature, please. Very good. Please follow us on Facebook as well at ImageLift, right over here. And on Periscope and Twitter, YouTube, ImageLift. So now what we're going to do is we're going to elevate the skin. So, well, let me do this too. Thank you. We can turn that off. Very good. So we're done with the laser now. And so these are what I call my facelift scissors. Move that back a little bit. Thank you. We can have her pull out the fiber. So these are helping me to elevate the skin. I use both my left and right hand to operate. It makes you a little bit more versatile. It's like playing the piano with 2 hands. It's easier to be a little ambidextrous. I can do the full lift with my right or left hand. It just allows me to give an additional, easier angles on some of the techniques that we perform. Very good. Carol, how are you feeling, dear?
Good.
Everything's looking good. Can you take the fiber for us,
Yes,
please?
sir.
Thank you. And I want to take this opportunity to just thank our team. I'm so proud of our team. They do such a great job for us. I could not do this without them. Yes, Carol is awake, and it's safer this way, less risk and less expense. So for this side, I'm going to switch hands to my right hand and then elevate on this side. And it's just easier to do that dissection this way. Very good. Patients come to me and they say they don't want a traditional facelift. They don't want general anesthesia. So they say, what can they do? So that's why we talk about the ImageLift, or sometimes we'll do the mini lift, or I have an in-between. I call it the mid-lift. So everything's looking good. Ragnoa and Alfred, please. Yes, she is numb. She's taking relaxing medicine and the numbing medicine, the lidocaine with epinephrine. Thank goodness for lidocaine. What did we do before lidocaine?
Does that hurt?
Are you feeling any pain there, Carol?
No.
Okay, perfect. No, she does not feel pain. The average age for this procedure, patients in their 50s and 60s will do this, but some patients are in their 40s, rarely in their 30s, but I have patients in their 90s. And we say, hey, you know what? When I'm in my 70s or 80s, I won't care. We still care about our appearance. We want to do the best we can with what we've got. So that's why I'm here, and it is an honor. You know, a lot of people, they raise their family, they go into their career, they put everyone else first, and then they say, well, now it's time for me. And that's an honor that we get to be a part of Carol's life and our patients' lives where they can. So that's some of the fatty tissue. Okay, that's fine.
Thank you.
Thank you very much. So a little bit of the fatty tissue. Okay, and so we just take out a little here and a little there. Some of it gets treated by the laser.
They spent $4,000 on the filler. Should have consulted this.
Yeah, I'm just talking and describing what we're doing. Some people say, well, does it distract you to do the video? Actually, it heightens your awareness. And I think one of the best things that you can do is videotape your procedures, because when you watch them, you know, after the fact, you learn more about your operating technique. And people, we generally tend to do a better job when people are watching you. Now, of course, I'm going to do just as good a job as I can, whether or not I'm doing video. But believe me, it heightens your awareness when you have people all over the world watching you. So I think that's a good thing. You know, before we started, Carol and I were talking about adrenaline, you know, and that's a great way to get your adrenaline up when you're engaged. And so I think it's a wonderful tool for teaching, for learning, for self-learning. And if the patients want to, we just need you to, from there, from that, you can plug and unplug again. There's just a lot of learning opportunities here.
Glad you're allowing us to watch.
You're welcome. It looks like some Russian there. Privyet. Thank you for watching. Can you zoom in a little bit on this one? So that's the, you can see there's really very little bleeding, which is a good thing. And even if there is bleeding, I can take care of that. I use my bipolar cautery, but it's by design that we want to do these types of procedures. Thank you for sharing. If you're just now joining, please let us know, where are you tuning in from, and what is your background? Are you medical, non-medical? And can you switch sides for me, please? Thank you. Hello, hello. Thanks for tuning in. Yes, it's the Smile Doctor here. I'm going to turn your chin up a little bit. That's perfect. Is that okay for you like that, Carol? Okay, thank you very much. And we're so lucky that we have great patients like Carol. She knows the power of smile.
Non-medical from California, non-medical from Orlando.
Hello. Yeah, let us know. Are you an engineer, attorney, stay-at-home parent?
What are you putting out of her face?
It's fatty tissue. We figured she didn't want it anymore. So that's just some of the fat that we take out, okay? So we do liposuction, we do the laser, we trim it a little bit. Very good. A little bit here, a little bit there. I like to be very, you know, picky about
what fat looks like?
what we do. Yes, it does. It's a yellowish color.
Soon to be college student taking up pharmacy.
Yeah,
An engineering student.
Very nice. Thank you for joining. Yeah, fat looks similar throughout the body. Sometimes it can be a little more yellow or white. Very good. Now what I'm going to do, now that I've trimmed most of the fat that I see, I'm going to do a little stitch. And the stitching, this is called a platysmoplasty. So the platysma is a fine sheet of muscle in the neck.
Criminal justice study?
Say that again.
He was a criminal justice.
Okay, very good. Thanks for watching. So now I'm stitching together these edges of the platysma muscle to tighten up the neck and the jawline, the banding we get in the neck.
What kind of surgery is this?
We're doing a facelift under local anesthesia. Very good. Perfect. Carol, how are you doing, dear?
Good.
Everything's looking good. Okay. And we need our French translator. Can't understand that.
Je parle un petit peu français.
There we have our French translator here. It's the patient though, so she can't see it. Although when we turn
Can we see
your head,
before and after?
yeah, we will show that. So stay tuned because we're going to show some of that. So yeah, I know how to say j'aime jouer au tennis. I enjoy playing tennis, and j'aime faire de la natation. That's the only thing I know how to say. I like to go swimming, but speak a little bit of Arabic, a little bit of German, speak Spanish fluently. Oh, good, they understood my French, yeah. Où est l'autobus? You know, I guess little things I know how to say, but that's it for me. Oh, you like my accent? Oh, thank you. Very good. Thanks for tuning in. If you're just joining, I am Dr. Rich Castellano, double board certified. Thank you very much. Appreciate your prayers. We have a successful procedure. It is already a big success, and we're very proud of Carol. Perfect. We're doing a facelift under local anesthesia, where we tighten the neck and the jawline. Yep, we definitely need French translation for that. Don't know what they're saying there. But it looks like a good question.
Carol's gonna look really beautiful.
She already looks beautiful. We're just helping her look a little younger. Which, by the way, who knows the most attractive thing we can do to our face? Let's see who knows this. That's fatty tissue that we're bringing out. The most attractive thing that anyone can do to their face. Let's see who knows what that is. Who knows? There it is. Smile. That's right. I can't beat the smile. The smile always looks the best. So I can help people look younger if they want to look. Oh, they said, Carol, they're doing a good job on you. They're watching out for you, Carol.
Thank you.
She says thank you. And so I can help people look younger. If they want to look younger than what we can achieve with the treatments, then they just have to act immature. So everything's looking good. Yes, she is awake. She's relaxed, taking a few of the relaxing medicine. I feel pretty relaxed too, but I didn't take any of the relaxing medicine.
Can you give me fake abs?
It's fake abs. Well, sit-ups. Hello from South Bend, Indiana. Some of those fake abs I've seen, it looks like they would like stop a bullet. Like they look tough, you know.
Why are your patients always awake?
Right, it's safer this way, less risk, less expense. That's what patients are looking for, so that's how they find me.
Hello from Brazil.
Hello, Brazil. Thank you for tuning in. A lot of plastic surgery going on in Brazil. Very good. So yeah, you know, be careful with the fake abs. I don't know how good they always look.
What's the stuff that you pulled out of the chin?
It's fatty tissue that we're pulling out from under the chin. Perfect. Everything's looking good.
Does the patient pay for anesthesia?
Well, here it's included in what we do, but it's the local anesthesia and the relaxing medicine. But if you have a general anesthetic, that increases the complexity, it increases the risk, and yes, it does increase the price.
Do you know Frank Ribery?
Oh, who was that name again? Frank who?
Ribery?
Frank Ribery. I know Riger, I know Dr. Riger, but Ribery.
My son's getting tumor surgery today.
Oh goodness, well hopefully everything goes well for you. Keep you in our thoughts that goes well. Best of luck. And so Stitching up the platysma muscle allows us to improve the profile.
Love when you say everything's looking good.
Yes, that's our job, to make sure everything's looking good. And it's our job to be better communicators. I think that's one of the biggest deficiencies in medicine today. I mean, we have some of the best healthcare the world has ever seen in the history of the world, but still I think we can benefit from better communication and building better relationships with our patients. So we
That's
actually
cool.
do teach bedside manner.
Going to med school to be an anesthesiologist.
Oh,
Got
very
a long
good.
day ahead.
Yeah, very good. Well, that's good. My brother-in-law is an anesthesiologist and he enjoys that. Very good. Everything's looking good. Perfect.
You are a really blessed doctor.
Oh, well, thank you. Yes, we do have a lot of blessings. You know, people always talk about, say, boy, I'd love to win the lottery. I mean, we certainly feel like we've already won the lottery. I mean, with the patients we get to spend time with, the work we get to do, their team. I mean, we have a lot of great opportunities and privileges. I think most people in the United States can, you know, have so many opportunities. It's like winning the lottery compared to some other places they
How
could
much
be.
math do you apply to your job?
Yeah, I do math every day, all the time. I measure the amounts of medicines that I give, the amounts of fillers that I do. I make proportion analysis throughout the face, geometry, algebra. All of those things are calculations that I constantly am doing in my head. So math is important, even though I don't, you know, recite the Pythagorean or the quadratic equation, you know. I know the Pythagorean theorem, but the point is, it's very relevant and relatable, specifically when you need to run a business. That's why we're very proud to teach other doctors.
No calculus.
Switch
though?
those, please.
Mm-hmm.
We're proud to teach other doctors, Practice Profitability MD, how to run their practices. You know how many doctors I've met that they just are struggling because they don't know how to run their practice. They don't know how to do the math in their practice. And so Practice Profitability MD is our opportunity to teach other doctors, here's how you do it based on what we're doing in our practice. Very good. Switch for me, please. Perfect. Okay, now we will be rebroadcasting in a bit, so make sure you are following us. You don't want to miss our broadcast.
Someone said they love watching.
Oh, thank you very much. Release for me, please. We love having you as an audience. Okay, perfect. So what I'm going to do now is, hold that for me, please. Thank you.
Mm-hmm.
Trimming just a little bit more of the fatty tissue here. Carol, how are you doing, dear?
Good.
Perfect. Okay, release for me, please. Okay, now what I'm going to do is I'm going to turn her head to the side, and we're going to focus on around the ear area. Everything's looking good. 1% lidocaine with 1 to 100,000 epinephrine. Yep, Carol is doing great. Do you feel a little bit of a pinch there or not really?
No.
You might feel a little bit of pinch. I'm putting a little bit of the numbing medicine there. Perfect. So if she feels any pinching, then she'll let me know. That's my 15. Yeah, some people, I've had some patients tell me, they say, oh, I have to be put totally out. And I say, well, let's do the relaxing, and if you feel, you know, comfortable, and they say, wow, I didn't, you know, I feel so comfortable and relaxed. You feeling any discomfort there at all?
No.
Okay, good. So I've had patients tell me, though, I absolutely have to have general anesthesia, and then they do just fine. They say, wow, that was easier than what I thought. We try and make it easier than getting a tattoo. Very good.
So do you feel the very first beginning of the shots?
Right, when we're doing the numbing medicine, you'll feel a little pinch there?
In the beginning I did.
In the beginning, yeah, with the numbing medicine, you'll feel some pinching. But then, how about right now? Do you feel any pinching, Carol?
No.
Okay, good.
Just pressure.
So she feels the pressure, and her lips will move funny when there's numbing medicine, like you've been to the dentist's office, puff, 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 and that's normal, and that goes away. Yes, she is speaking. I can understand. Elle a parlé. So she's speaking.
Mm-hmm.
I understand some of that if it has a Spanish root. Very good. So I'm doing traction for the medical students and surgeons watching that want to improve their technique. Counter traction, traction and counter traction. And then that allows me to have a more precise dissection. Subcutaneous. Very good. Perfect.
What are you doing now?
We're lifting the skin. And as Carol said before, she's had a treatment in the past, and now we are just, there is a little bit of scar tissue here, which is what we expect, but it will not impact or hurt our ability to get the result we're looking for. It actually helps, I believe, because when you've had a lift before, typically you don't need as much. And I have many happy patients who have had facelifts before. Now they just want to tighten things up again, and it's not as if you're starting from scratch. They already have a foundation of the scar tissue that was set from the first lift, and you just work within those means. Now, we're lifting in front of the ear. This is a preauricular incision. I like to make this is a preauricular incision here by the helix, the root of the helix. This is a postragal incision, where the tragus is that little bump in front of the ear. You want to make sure you recreate that so that the ear looks normal. And tragus is the Latin word root for billy goat. It's like a billy goat's chin. Thank you for your comments. Thank you for your share. So now I'm elevating in through here, so I use my left hand. For this side, it's just easier to get the angle right there. Very comfortable. I could use my right hand here as well, but this allows me to go the length of the skin flap. Very good. So every time I talk with my patients, I talk about tightening, volume, and skin, okay? Tightening is the foundation where a lot of people start. Volume, fillers are the future of plastic surgery. There's no downtime. Results are great. Ear forward for me, please. Everything's looking good. Please do follow, and please lots of hearts and shares. Allows us to spread the message. Tightening, volume, and then skin. Sunscreen, sun protection, steamed and raw vegetables, avoiding smoking, 2 to 3 liters of water a day. All of those things help your skin to be healthy and have anti-aging properties. Very good. Release for me, please. Perfect. All right. No, she does not feel what we're doing. She knows we're there. She may feel some pressure. Do you feel a little bit of a pinch right there?
Pressure.
Pressure, okay. Now, Carol, you had a chance to read through our book.
Mm-hmm.
What did you think about our book?
I liked it.
It's very informative. Some patients will read it more than once. And you were at our seminar.
Yes.
How would you describe our seminar to someone who's never been?
It was upbeat. You had a lot of people there who had the procedures so that we could actually see them in person, and
Yep.
they were very happy to share and answer any questions.
So we're an open book. You can get our book. You can download that on Amazon and Kindle. You can come to our seminars. We do 3 or 4 seminars almost every month, all around Florida. Ear forward for me, please. And that way patients can get to know us and feel comfortable with what they're going to do.
Someone said this is too much money.
Well, it depends on, it's interesting the money we spend on. People may spend thousands of dollars on clothes that they may wear once and never wear. We wear our face every day. And if you think about can you really put a price on your confidence? People, I love seeing our follow-ups, and they come back and they're standing a little taller, they're smiling bigger, their confidence is higher there. You have a little more step, more confidence in their step. Exposure for me, please. Let me go ahead and turn the lipo on for me, please.
Sure.
Everything's looking good. Thank you for your comments. Thank you for your support. Doing a little bit of liposuction here. You know, I think our Snapchat account is Real Smile DR. I don't use Snapchat anymore because most of my patients are on Facebook. That's little fatty tissue, or what you see there, the yellow part, okay? Now I'm doing a little bit of numbing medicine. Please do make sure you're following us and do share. This is 1% lidocaine with 1 to 100,000 epinephrine. We will be rebroadcasting in a little bit, so make sure you're following. ImageLift.
Snapchat is for kids.
More adults are on Snapchat, and I do like Snapchat a lot, but there's only so much you can do in the day, and I can't just be glued to my phone all the time. I mean, it gets, you know, gotta take a break. But, you know, if I do Facebook and YouTube and Periscope, that's enough. And even Instagram, I don't have as much time for that. But a lot of my patients aren't on Instagram on a regular basis. I mean, they're there, they may have an account. So right now I'm lifting a little smash flap here. Okay?
Someone said it looks like we're being rough.
How are you feeling, Carol?
Good.
Does it feel rough?
No.
See, Carol doesn't feel that. So what I'm doing is I'm very careful to make sure that she's super comfortable. Now, when I have patients who have done the procedure and they watch their own procedure, they say, you know, it really looked like you were doing a lot more than what I felt, because they just couldn't tell. So I'm very tuned in that we're bothering Carol as little as possible. And, you know, you got to be sneaky. Sneak in and sneak out and lift this and tighten that without them really knowing it, then you did a good job. So, little facelift ninja. So we have a nice smash flap here.
Does lifting the skin not let the germs through the air?
Does lifting that skin not let in germs through the air? So there's germs everywhere in the air, but however, we've got a clean, sterile environment as far as our instruments. We wear sterile gowns, sterile gloves, and so we have an outside consulting firm. They monitor all of our practices consistent with, you know, surgery centers, and so we are very proud of our sterility. We're very proud of our results, very low infection rate. It's rare people get an infection. If they get one, we treat it and cure it, but it's uncommon that patients would get an infection from something like this. Now, we live with bacteria all over our skin. That's a fact of life, and so but we put patients on an antibiotic as a precaution to just make sure that we are stacking the deck in our favor. Very good. Oh, well, yes, the results are a huge improvement. I tell patients, you know, I'm a perfectionist at heart. Which plastic surgeon isn't? But perfectionism in plastic surgery can be dangerous. We're doing a facelift under local anesthesia because you may be inclined to try and choose a treatment that goes too far. You don't want to choose something that goes too far, and that's my job to protect my patients from looking unnatural. I won't let that happen. That's number one. Number two, you may get a very good result from a procedure, but if you're a perfectionist about things, you may not enjoy a great result. So you want to make sure you get a good result, choose the right treatment, but don't be too hard on yourself. We never see ourselves the way that other people see us.
Is this a real person?
It does not get more real than Carol. She is the real deal. And it is pretty remarkable. And thank you so much. Please, lots of hearts and shares for Carol, because she was allowing us to teach and reach out all over the world to share this video and this training. Yes, there is a lot of elasticity in the skin, and as you can see, there's a lot of extra skin, and we're going to take care of that. Figure that Carol doesn't want it anymore. Very good. Everything's looking good. So I'm tying my little surgeon's knot there, and thank you for Nina. She's doing a great job.
Thank you.
Couldn't do it without her and with Charlene. Elise is off to a wedding today with her family, so we're proud of Elise.
She better bring me fudge back.
She better bring some fudge back. Very good. Thank you for tuning in. Thank you for the hearts and shares. Now, we are going to rebroadcast here in a little bit, so make sure you are following ImageLift on Periscope, ImageLift on Facebook.
I guess someone thinks we're being really rough, but
yeah, it's not
actually,
that. Patient's experience is that it's not. So this is so people can understand. Here's what it's like to do procedures under local anesthesia. And it's not for everyone, but most people prefer it. Most people prefer it. That's absolutely true. Very good. Thanks for tuning in. Thank you for the hearts and thank you for the shares. You feel like getting a little bit tighter there, Carol?
Mm-hmm.
Okay, good. Very good. Please do share. You can swipe left or right on iPhone to share with your friends or Facebook followers or Twitter, and you can swipe up or down on Android to swipe to share. Let go, please.
Mm-hmm.
So all this extra skin, we're going to remove that. And I'm so excited for Carol. She's going to love her result. And if she came out to one of our seminars and saw other patients, now if she wants to, she can come to a seminar and be a model, and she'll be a celebrity, and everyone will say, "You look great. How was it?" You can show them your video if you choose. Now, Carol, do you think you'll watch your own video, or some people they don't want to watch?
Oh, yeah, I probably will.
So see this excess skin, we're going to trim that away. Okay? Thank you for keeping your comments nice. Appreciate that, your support. And so it's a great tool for patients to say, you know, I do want to see my procedure. Great, they can watch it. Very good. Measure twice, cut once, as the saying goes. Perfect.
someone says she's one tough cookie.
She's tough, but you don't have to be tough to do this. I've had patients tell me they're the biggest sissy.
Mm.
My niece was 3 years old when I got the phone call. She bumped and opened up her forehead and she needed a few stitches, and we stitched her up, and she did not shed one tear. And I guarantee if I can make my 3-year-old niece comfortable, I will make you comfortable too, and you can have a lollipop too. Like she Very good.
How many weeks does it take to heal?
So there's physical versus social downtime. Physically, we get back into our routine, errands, shopping, things around the house within a few days. Socially, we pass the grocery store test.
What about yoga, Tai Chi, and Zumba?
So grocery store test, 7 to 10 days. Yoga, Tai Chi, Zumba. Light yoga, you don't want to be doing downward dog, but light yoga I think is fine in the second week, and just modify your position so that way you don't want to put your head below your knees.
So maybe 3 weeks, 4 weeks?
No, second week you can start with the yoga, I believe.
Okay.
Someone said their chin shrank like Jay Leno.
Huh.
Well, come see us, we can help you out. Okay, Ragnell and Alfred. Okay, so we're wrapping things up on this side. So if someone wants we do ear repair, right, because sometimes the ears can be pushed out a little bit, and we can tuck those in, and that takes me about hour and a half to do, and very high satisfaction with that. It's called an otoplasty. So now I'm using the bipolar cautery. Very good.
So she's numb on her face.
Yes, she is, because of the numbing medicine we put there. Thank you for tuning in. Thank you for the hearts, and thank you for the shares.
How much for liposuction of fat of the waist?
Yeah, it depends on how many areas. So you need a consult for sure. There's smart lipo, there's cool sculpting. You tend to pay a little bit more for the non-invasive because there's no downtime. You're paying a premium. Hello, thanks for tuning in. If you're just joining, I am Dr. Rich Castellano. Yes, Carol is awake, and she's doing really well. We're doing a facelift under local anesthesia. People today, they don't want traditional facelifts. So that's why they're doing what we're doing here today. Behind the ear for me, please. Please do follow us at ImageLift on Periscope, on Facebook, and please do share. Let others know. Thank you so much for Carol's generosity to allow us to share this procedure. A little bit of scar tissue here that I'm going to remove. Very good. Perfect. All right. Yeah, someone wants liposuction for the love handle. You need a consult. Let me know where you are and I can make some recommendations. Email me, rcastellano@imagelift.com, or message me on social media and I'll get back to you. I make plenty of referrals to doctors for things that I don't do because I only focus on the face. Very good.
How many hours does a procedure like this last?
Usually it takes me 2.5 hours to do the lift. If I'm doing it with the laser, 2.5 hours to do the procedure. People typically come back after 5 to 15 years and say that may do another lift. Some come back after a year or two. Some may wait 20 years. It just depends on the person. Definitely not a car accident here. And this is live surgery.
Do you know a good surgeon in the Seattle area?
Depends on what you're looking for. I know a lot of good surgeons in the Seattle area. Email me your information. Okay?
What's the email?
rcastellano@imagelift.com, and I'll send you. Let me know what you're looking for, or send me some of your pictures, and then I can give you some indication. Everything's looking good. Thank you for the hearts and thank you for the shares. We usually have a few thousand followers for each procedure that we do, and perfect. Everything's looking good, Carol.
Great.
Do you know any in Texas for ears?
Yes, I do. Email me, rcastellano, rcastellano, rcastellano @imagelift.com. Very good.
Hi, Doc. Sup, Doc? Good
Hello,
job.
hello. Please do share. Let others know. Look us up on Amazon, audible.com.
Can she feel what you're doing?
Can you feel what I'm doing there?
No. I smell smoke.
She smells the smoke. That's the cautery. Okay, 2 right now. Okay, so we're stitching things up on this side. Very good. So she's doing retraction with that. This is my 2.0 Vicryl. A lot of French comments. Sorry, I don't speak French. We need our French translator. But welcome.
Oh my gosh, can't believe she's awake.
The only French I speak is that's j'aime jouer au tennis, j'aime faire de la natation. That's où est l'autobus. That's it. But I hope I said something meaningful to you, but otherwise it's all in English. Very good. Yes, she is awake. rcastellano@imagelift.com. I will have to add that to our thing. rcastellano@imagelift.com. And message me. You can message me on
What's this thing here?
Periscope. That's a little towel clip that keeps the head wrap in place. Thank you for asking.
How long does it take to heal?
Physical versus social downtime. Physically, we get back into our routine, errands, shopping, things around the house within a day or two. Socially, we pass the grocery store test.
Is the
7 to
towel
10
clip
days.
stuck in her forehead?
No, it's only in the thing.
Towel.
Definitely not. It's only in the towel. It's definitely not stuck into her forehead. No. No, no, no. Everything's looking good. No. Hold on. No. Go ahead. All right. Now, please do share with your followers. Let them know you're watching live surgery.
What kind of meds did you give her?
We give relaxing medicine by mouth and then numbing medicine like at the dentist's office. Everything's looking good. Perfect. Thank you for the super hearts. Really appreciate that. That helps us out. We are really, I'm going to do one more with that. We are spreading the message.
No anesthesia?
No anesthesia. It's all under local anesthesia. I'm still trying to figure out what it means if you get so many super hearts, but we keep...
I know, that's new.
Yeah, super hearts. Thank you so much.
Baby picture.
I faire de la natation. Yes, that's true. I do enjoy swimming. Actually, I was faire de la natation this morning. I was swimming this morning. I was in the pool. It's a great workout. J'aime faire de la natation. I do like to swim. And I was this weekend. J'aime jouer au tennis. I was playing tennis. That's why I remember, because I like to do those things.
Are you reading this, or do you have headphones that read it to you?
So we have, the comments are projected on our Jumbotron, so I can just pause and take a look. Nina reads out some of the comments, or I can look at them and read them. Thank you for keeping your comments nice, and a lot of supportive people. Really appreciate that. Very good. Oh, money? Oh, I don't need money for Super Hearts, but we do want to share the message, that's for sure. But thank you. Release for me, please.
Mm-hmm.
Okay. And the tenotomy.
Mm-hmm.
We are in Tampa, Florida, and in the Villages, Florida. Yeah, we calculated that we needed like 150 more broadcasts before we would cash in those super hearts or whatever they do or whatever they mean, because we do a lot of broadcasts. So very good.
You do what with super hearts?
Yeah, you trade them in for I don't know. It's for money, but I don't know.
Money.
Yeah, there's different rules for whatever. I mean, we just want to get the message out. We love to share. We love to teach. We've been doing a lot of podcast interviews lately. Yeah, some patients do rest and they may drift a little bit, but it's under local anesthesia, so they're not put out completely. So now this is a 5-0 chromic.
Do you offer military discount?
Yes, we do. Thanks for tuning in. Give us a call, 813-463-9245. Set up an appointment. Everything's looking good. Perfect. Cut, please.
Mm-hmm.
Yes, we do not charge for the consultation, and I have students. If you're a medical student or medical related, I do have medical students come in and watch in what we do. Thank you so much. Medical students, surgical students, nursing students, all of those have been through our office. We do that on a regular basis. We're always teaching, we're always training, we're always learning. Perfect. Everything's looking good, Carol. Yeah, reach out, let us know. Thanks for tuning in. Appreciate you watching. Lots of hearts and shares, please. Perfect. Share on Facebook, share on Twitter. Go to Amazon. You can download our book, our audio book.
What surgery are you performing today?
We're doing a facelift under local anesthesia. Make sure that you are following, because we're going to rebroadcast in a little bit. We're doing future broadcasts. Perfect.
Do you do breast jobs?
If you pull on the face really, really tight, sometimes you get a little bit of tightening in the lift, in the breast, and the tummy. I'm just kidding. That's our joke. No, I do not, but I do refer that to other people. So let me know where you are. Here you go. Thank you so much for your comments and your shares. This is not for everyone to watch. Very good. Perfect. So 5-0 chromic, this is a dissolvable suture, it falls away.
what does this type of surgery do?
This tightens the neck and the jawline. I'll show you in just a moment because we will rebroadcast in just a little bit. Perfect. So you can see her jawline looks really nice and sharp. You're going to love it, Carol. No one complains that they look pulled or overdone, and no one complains that they look too young. It's fun, you know, and people say, well, is this about vanity? You know, our appearance is a tool.
Will she have pain after?
We use our appearance for positive or negative. When you use your appearance negatively to put down others or put down ourselves, that's what I think vanity is. That's what I call vanity. But when we use our appearance positively to inspire other people or inspire ourselves, that's called style. So we're excited to be a part of Carol's personal style. Yes, we give pain pills afterwards that I recommend every couple of hours. Patients check to see if they need a pain pill. If you go to sleep for 6 or 8 hours in a row, you may get behind in the pain medicine. That's not the end of the world, but it's preferable to avoid that.
Also, someone asked if a double chin procedure is hard.
This is one of the things we do for, you know, the quote-unquote double chin. So you've come to the right place. Very good. Okay, so we are wrapping things up on this side, and what you can see is that, look at her neck and jawline. Yes, to help look younger and look our best, I'm going to share with you so you can see where things are. And this is Carol's before picture. We just wanted to tighten up her neck and her jawline, and so you can see her jawline here and the sagging excess tissue, and now we've tightened those areas up. And now when you look at her neckline here, you see what a difference and how sharp that is. So thank you all for tuning in. We'll have more to come soon. Please do follow us at ImageLift, and thank you for watching.